Hello everyone, and hi Bill. I wanted to address the answer to your questions in a video because it was concerning to me that you had never heard of anybody having these symptoms before. I guess one of the benefits of going to a Lyme clinic is that I was able to hear that both of the things you were talking about with the visual disturbances and with the body odors are extremely, extremely common. A lot of people have the body odors before they do know what's going on, like, as you said, because they're not detoxing and they don't know that they're not doing things properly. They're probably not eating the correct foods and everything, and are feeding any kind of bacteria, parasites, yeast in their body that's created even more. You can even get an ammonia smell in your nose, which you smell, but nobody else can smell. Garlic and onions are the two most common smells that you get. And then also when you get to a certain point in treatment is commonly known as the smell of death. And it is literally the cells of the pathogens inside you dying off and your own cells dying off, because it does kill a little bit of your own cells to kill the bad cells. And then with the visual disturbances, those usually come along with whenever your nervous system is being overly taxed by toxins. I have a girl that I know that I went through my last part of treatment with, who was seeing a neurological chiropractor, I believe, in the Phoenix area, and I tried to look, but I couldn't find a name that stood out to me, so I'll have to ask her who she saw. But they approach things very, very differently. Some of the things I had done in the past, they had used light therapy and movement therapy and different things to try to get you from not going into a seizure for certain movements, and or being able to tolerate more light, being able to tolerate flashes of light, just all these different things that the average person should be able to filter out without having a response to the stimuli with a seizure or severe neurological pain. The visual disturbances with reading especially is very, very common for me. I actually get where my eyeballs will start to shake back and forth really fast, and I'm kind of like waiting, like, okay, it'll go away in a second. Just kind of give it a few seconds, it'll go away. And then the blurriness. I don't drive because my vision is way too bad, and it's completely unpredictable. So all of those things that you're experiencing are completely normal to whatever variation of it you have. Those are things that not only I myself have had, but every single Lyme patient that I was in treatment with throughout the 16 weeks, the first time I went through treatment, and then these last 4 weeks of going through treatment, I have been talking with people that have had, every single person has some variation of these symptoms. So hopefully that's some comfort to you and to everybody else that's watching this, because it is concerning to me to hear that you have never heard of other people that are going through this stuff, which totally makes sense. Like, if you aren't in a clinic or you talk to people every day, that you wouldn't have these conversations with people. It's not your common typical situation to be talking about things with. So I hope I gave you some comfort or answered some questions. Please ask me if you have any specific questions that I didn't touch upon, and I will talk to you later. Bye.